Hello, and welcome to Black Girl Joy, where we spark conversation and inspire your thinking. My name is Nicole Celine, and I am your host. Welcome. Well, hello everyone. Hello. How are you? I pray that all is going well. Today on Black Girl Joy, I want to talk about the leak. And as women, we know all too well about the leak, right? And if you don't know what I'm talking about, then you're probably a little too young for this. But it all depends. I'm talking about incontinence. I know it's a topic that, most times there's so many topics, as I'm doing this and I'm recording this for you guys and I think about it, it's like I think about so many things that people don't want to talk about. And the question always comes, I'm a why girl, right? And it's like, why won't you want to talk about it? It's necessary to talk about, especially if it pertains to your health and your well-being, right? Something like being incontinent is pertains to your health, and it's a part of your well-being. They have commercials now, and we have Poise, and we have Depends, and we have all kinds of things that they didn't really have in my mother's days, or even in my grandmother's days. And did they really ever talk about it? No, they didn't. You just saw them running to the bathroom. It's like, well, what's wrong? Why are they running? Or, if they laughed a little too much, they'd make faces or turn red or, and I I laugh, and it's ironic that now, so many things are out in the open. And I'm thankful that they are in many ways, because it has helped me and shaped me, right, in the woman that I am becoming, or that I am. And but I will say the woman that I am becoming, because my birthday is coming soon. In another 3 months, I will have another year added on with God's blessings, and I am truly becoming the woman that I've always wanted to be. So I want to talk about urinary incontinence. That is the technical medical term of it, right? And you're like, well, what is that? Okay, well, it's the loss of bladder control. You're, vaginally, sometimes whether you cough, you sneeze, you laugh, and all of a sudden you get a squirt. You're like, ooh, what was that? And you're standing there and you're hoping that no one else, that you didn't, it didn't go through your liner or the underwears or your pants. If you don't wear liners, some people don't like wearing liners. So you're hoping that it doesn't go through, because then you're going to have a wet spot. And of course, nobody wants that embarrassment, right? But urinary incontinence is a real thing for us women. I'm going to ask the men. I think that maybe they too may have that, but in a different form. I'm not sure, but I can always, hopefully you guys out there that are listening, you let me know. You guys are welcome to write in. You are welcome to send me an email. The email is www.blackgirljoyllc@gmail.com. Let me know. Talk to me. I'm definitely interested in knowing. Everyone's not going to agree with you. Everybody's not going to like what you have to say, yada yadas, but I'm not here for that. I'm here to tell you about this journey. So, let's talk about the leak, all right? Because, like I said, this is what it is. And it depends. It's not always because you had a baby. Sometimes it's stress, it's traumatic, it's something happened, it's medical. So I want to go through some of the um, reasons for the incontinence, and then I'll get into what you can do or what maybe may work for you, right? So, common causes don't always stem from underlying diseases. Some of the underlying, yeah, they do stem from that. From some of the underlying diseases are intoxication, coughing, sneezing, extreme anxiety, or intense laughter, right? And that will cause you to have a little leak. For some, it's a little leak. For others, it's like, Niagara Falls. But that's just the truth. You know what I'm saying? So, for me, my incontinence to some degree was because of my pregnancy. I've only been pregnant once, and I have a beautiful young woman. And that was, for me, the reason for it. And I was talking to a girlfriend, and I was telling her, I says, what do you do at I'm still young. It's like I'm still very young. I still have some vigor in me, although I find myself taking naps in the middle of the day, which is not normal for me. But at this stage and at this young age, yeah, nap nowadays sounds real good. So when and I have had many of instances of laughing and having an accident, of coughing or sneezing. God forbid my allergies take over and I have a sneezing fit. Well, there goes those underwears, because God knows. So let's go into the types of urinary incontinence, right? So we have the stress incontinence, which occurs when urine leaks as pressure is put on the bladder, such as during your exercise. And once again, here we go: coughing, sneezing, laughing, lifting heavy objects. It's a common type of bladder control problem in younger and middle-aged women. It also may begin later around the time of menopause. Hello, everyone. Why did I start this? Because of menopause. All right. So the other one is urge incontinence, which happens when people have a sudden need to urinate and cannot hold their urine long enough to get to the toilet. It may be a problem for some people who have diabetes, Alzheimer's disease, Parkinson's disease, multiple sclerosis, or if you had a stroke, right? And now we have the overflow incontinence. This happens when small amounts of urine leak from a bladder that is always full. Here goes the part for the men. A man can have trouble emptying his bladder if an enlarged prostate is blocking the urethra. Diabetes and spinal cord injuries can also cause this type of incontinence. Functional incontinence occurs in many older people who have normal bladders, normal bladder control. They just have a problem getting to the toilet because of arthritis or other disorders that make it hard to move quickly. So that right there, for those of us who are struggling with movement, this should get you to want to move more, want to stay active, want to stay mobile, want to stay, just stay moving. That's why older people are always like on the go, taking exercising classes, doing yoga, doing Tai Chi, so that they can keep themselves mobile. Because no, this does not happen to everyone, but to those of us that it does, it can be quite embarrassing. All right. And then, so you're probably like, so what do I do about it? Well, okay, let's look. I'll tell you about me. I've always done Kegels, right? And if anybody knows, it's tightening those muscles in there. And the best example that I've had and that was given to me many, many moons ago was when you're going to the bathroom, young ladies, you let a little bit out you hold it. You let a little bit out, you hold it. You let a little bit out and you hold it. And that exercise consistently, or doing, just the Kegel exercises, right? Consistently helps with keeping and training that urinary part of you, right? Helps with keep and training that muscle. And that will help you in the long run, because you want to be making sure that you don't have a leaky problem. I guess that's why we have those poise. And I love poise, so I will tell you they work really well. Had to use them occasionally. Asked my girlfriend. I am not endorsing poise. I don't have knowledge of the company like that, but I will say, because I have used them, I can tell you that they work. I truly enjoy them. They don't leave a funny odor, because I have an odor issue. My OCD when it comes to odor is over the top sometimes. So it doesn't leave you a funny odor, thank the Lord. So let's talk about training for your bladder. You can do the pelvic muscle exercises, which is what I just said, which are known as Kegel exercises. You strengthen the muscle that support the bladder, which can help you hold your urine in your bladder and avoid leaks. You can do urgency suppression, which helps control strong urges to urinate so you can make it to the toilet on time. For example, you can try distracting yourself to help keep your mind off needing to urinate. Like, especially if you're watching that good TV show and you're like, wait a minute, I'm going to get there, but let me see what happens. I don't want to miss it, right? Who has not been there? I have many a times been like, and then when the commercial comes, I'm running like there's nobody's business, right? You can set a plan to urinate every hour as time goes on. You can slowly extend the time between, I'm sorry. My notes. Okay, so for urgency suppression, so here are the distractions. Distract yourself to help keep your mind off needing to urinate. Taking long, relaxing breaths. Holding still. Squeezing the pelvic muscle. How many know, like, you're coming up the stairs, you're going home from work, and it's like your body knows that you at the door. And I'm telling you, I just don't know, but it knows. So the next one is time voiding. This, I don't know if this would work, but it's like scheduling yourself to go to the bathroom. So basically, if you went to the bathroom at 9, you schedule yourself to go to the bathroom at 11. Me, per se, it doesn't really work. That doesn't work for me, and I'll tell you why. I drink a lot of water. So doing that for me just doesn't work, because I've got to pick. The moment I drink the water, I need to go to the bathroom. Yeah, that's just, that's just what it is. Now, there are other treatments, and I'm not going to go into all of them. I'm only going to go into a few that I've asked and talked about, and I've tried myself, right? So one of them is medications. Now, I didn't try medications. I'll tell you the one that I tried. I tried it was like a medical device, and that didn't work too well. It just was very uncomfortable for me. But like with medications, they give you a pill, a liquid, or a patch to help with bladder control problems. Bladder control problems. Say that 3 times really fast. But sometimes the medications can make the bladder overactive, and then you have a whole nother issue, right? And then some of those medications have been associated with having cognitive decline or higher risk of things like that, especially for adults 65 and older. And they need to keep their brain intact, right? You have vaginal estrogen cream. Now, because cancer runs on both sides of my family, taking hormones is not the best option for you. For me, excuse me, I'm sorry. However, I will say for you, if you know that cancer runs on both sides of your family or are prone to it, I would not recommend anything that has to do with hormones. That's just my recommendation. You can talk to your doctor. So that's the vaginal estrogen cream, it helps relieve the urge of stress incontinence. A low dose of the estrogen cream is applied directly to the vaginal walls and urethral tissue. Okay. You have electric nerve stimulation. Sends mild electric currents to the nerves around the bladder that help control urination and your bladder reflexes. I'm not sure if I want to have any electrical nerve stimulation. I don't know about y'all out there, but that don't sound good for me at all. So I want to go over again what incontinence is. Incontinence can happen for many reasons, including a urinary tract infection, vaginal infection or irritation, or constipation. Some medications can cause bladder control problems that last a short time, but when the incontinence lasts longer, it's also a science or a feeling of your bladder then becoming slightly weaker, right? And so we need to make sure that we stay on top of doing our exercises, doing what we need to do in order to keep that bladder nice and tight and keep everything that you need in there, right? You don't want nothing coming out. Because then you'll have that saying like I do, what had happened was... So today I wanted to just talk to you about, the infamous leak and tell you ladies that you're not alone and that there is help out here. Find yourself a good GYN who can help you with whatever issue you may be having, and she can refer you to someone who can help you to diagnose and really see where your vaginal lady parts and how they're doing, how they're changing, because as we get older, they do change, right? Your pH balance changes. All of those things start to change. Menopause is amazing. Perimenopause is amazing. I had in the past week or so, I've had this wonderful discussion with a woman at my where I pick up my prescriptions. And she happened to tell me that she was married at 14, but this is also due to her culture and where she's from. She's beautiful. Let me just put it to you this way. She is beautiful. But it was just interesting because I told her, I said, I started this podcast because I wanted to talk about the very things that we don't want to talk about. And I'm not afraid to face it face to face. I was telling her that I did my research and continue to do research and have a better understanding of the mental health that women go through from birth till old age. And I know you're like, what? Yeah, you go through different things as a woman from birth to old age, right? And everything in between. So I am coming into being middle age, and my body is nowhere near what it was when I was 20, not even 19. All right, let's take 40, which is only a few, 10 years ago. Let's just take 40. I can't hop, jump, and skip like I used to when I was 40. And my mental status is definitely different. One of my other girlfriends I was talking to about menopause is she was forced into menopause due to certain situations in her life and her medical condition. And we talked about mood swings. Mood swings are a real thing. You're hot, you're cold, you're hot, you're cold. You want somebody to touch you, you don't want nobody to touch you. You're crying and you don't even know why you're crying. You're angry and you don't know why you're angry. And you're just yelling at everybody. And I was telling the woman at the pharmacy, when I started looking and really reading about women in the 1300s, 1400s, 1500s, and how they would call them witches and the Salem witch hunt, or just, that understanding, people have read the book. But those types, or that type of mindset, right, was what was back then, because they didn't understand that, or the women themselves didn't understand that their body was changing. They didn't understand that, yes, they were getting older and their body was changing, because they were most times, we are so in do mode, in go mode, like my cousin said to me today. We're always in go mode that we forget to stop. Red sign, right? Stop and evaluate and look at where you are and look at your body, take notes, and then go to the doctor. Please stop self-diagnosing yourself. If nothing else, that I dislike most times in medicine is when patients come in and they've already self-diagnosed themselves. Sometimes maybe they could be right, but 90% of the time they're not. And please go and take care of yourself. Please go and get the self-care that you need. This is just, 2024 needs to be different for all of us. It needs to bring us joy. It needs to bring us good health. It needs to bring us prosperity. It needs to bring us love, right? So my goal with Black Girl Joy is to bring you love, is to give you love, is to give you wisdom and some knowledge, and hopefully you will seek understanding and to take care of you. At the end of the day, you matter, right? You matter. Whether you think so or not, you actually really matter. And I am coming to you to let you know that you matter, and that I want you to matter to you and take care of you. Go get that vaginal exam. You may not need to do a pap smear, if you're older. Now I think it's every 10 years or more, right? For some of us older folks. For the younger folks, you are not exempt. Let me just tell you, you are not in any way, shape, or form exempt from having issues vaginally, your breast or any your cycle. You are not exempt. So if there's something weird that you don't like, you don't understand, talk to someone. Talk to your mom, talk to your doctor, talk to someone, and don't ignore it and say it's just because you're a teenager. Please don't. And to the older adults, please make sure you get to the GYN like I was saying. Get your yearly checkup. Get your mammogram. Check your eyes. Check your cholesterol. All of these things need to be on your checklist. Doesn't mean that you're going to get it all done in one time, but it definitely needs to be a part of your checklist so that you are able to do a healthy self-care. Yeah, healthy self-care is more than important. It is the essential. It is the essence of who you are. So I hope today this has blessed you and that you've gotten at least some tidbits from this that you can move on and do greater things with, and you will be able to, speak to your doctor intelligently. So I thank you again and have a great day. My name is Nicole Celine. I am your host of Black Girl Joy. Have a blessed and wonderful day. Peace and blessings, guys. Thank you again for taking the time to listen to Black Girl Joy. Please remember to like and share our podcast and join our Facebook page on Black Girl Joy LLC. Remember to embrace the journey. Bye.